A 73-year-old woman is brought to the emergency department by her family. She complains of dizziness that started 2 hours ago. On examination, she is found to be bradycardic with a heart rate of 42 beats per minute. She is normotensive and has no history of chest pain or breathlessness. Her ECG shows a ventricular rate of 44 beats per minute, with a narrow QRS with a prolonged PR interval. There is no AV block. What is the recommended treatment for this patient? Options are A. Observe and refer for further assessment. B. Atropine 500 micrograms. C. Amiodarone 300 milligrams. D. Transcutaneous pacing. E. Adrenaline 100 micrograms. The answer is A. Observe and refer for further assessment. The patient is bradycardic without adverse features. There are no risk factors for progression to asystole. In a patient with no adverse features and no high risk of progression to asystole, do not initiate immediate treatment. Continue to monitor the patient and assess them to identify the cause of the bradycardia, treat reversible causes and seek expert help with further assessment and treatment. A 65-year-old man with a known history of poorly controlled hypertension presents to AID with sudden onset, ripping, chest pain that radiates through to his back. The pain is severe and was maximal at onset. His observations are heart rate 105 beats minute, blood pressure 175 by 110 mmHg, respiratory rate 20 breaths minute, oxygen saturations 95% on air. What is the most likely diagnosis? Options are A. Acute coronary syndrome. B. Pulmonary embolism. C. Acute pericarditis. D. Aortic dissection. E. Aortic aneurysm rupture. The answer is D. Aortic dissection. The usual presentation is a patient in their 50s with hypertension, but the condition may occur in younger patients who have a connective tissue disorder or a recent history of heavy lifting or cocaine use. Aortic dissection should be suspected when an abrupt onset of tearing or ripping chest or back pain is reported. Patients may be hemodynamically stable or in hypovolemic shock. Blood pressure differences in the upper extremities or pulse deficits in the lower extremities should be sought. Neurological deficits may indicate involvement of cerebral or intercostal vessels. There may be depressed mental status, limb pain, paresthesia, weakness, or paraplegia. Symptoms of visceral ischemia may be present. Occasionally, a diastolic decrescendo murmur may be discovered, indicating aortic insufficiency. There may be symptoms or signs of heart failure, pericardial tamponade, or a left pleural effusion. A 73-year-old woman is brought to the emergency department by her family. She complains of dizziness that started 2 hours ago. On examination, she is found to be bradycardic with a heart rate of 42 beats per minute. She is hypotensive and you commence treatment with atropine. Atropine can be repeated every 3 to 5 minutes up to what total dose? Options are A. 1 mg. B. 2 mg. C. 3 mg. D. 4 mg. E. 5 mg. The answer is C. 3 mg. Give atropine 500 micrograms 4 and if necessary, repeat every 3 to 5 minutes to a total of 3 mg.